8 tips to prevent osteoarthritis. Imagine this. You're in your 60s. You've been playing football for as long as you can remember. However, recently your knees haven't been working quite like they used to. They're sore, weak, unstable, and at night you have to take painkillers just to fall asleep. But that's not the worst part. Your doctor says years of harsh wear and tear has caused permanent damage to your knees, which has now developed into an incurable condition known as osteoarthritis. Hello and welcome to MedTouch, the best place to find the right medical information. Osteoarthritis is the most common form of arthritis in the world. The disease occurs when the protective cartilage at the end of your bones, where your joints are, wears down over time, causing your bones to rub together and become damaged and inflamed. Symptoms of osteoarthritis typically get worse over time and can include mild to severe pain and aching in the joint, joint stiffness, joint swelling, and joint instability or buckling. Unfortunately, once you develop osteoarthritis, it can't be cured or reversed. Joint replacement or joint fusion surgery can be helpful in some circumstances. However, these procedures come with many side effects, costs, restrictions, and long-term limitations. But don't worry, there's good news. By taking better care of your joints today, you can help to slow or even prevent the disease from progressing over time. That's why in today's video, we're going to share 8 tips that you can use to prevent osteoarthritis and keep your joints happy and healthy for years to come. Tip 1. Avoid high-impact sports. High-impact sports can be invigorating. When your heart is pumping, your muscles are burning, and there's sweat pouring down your face, it's easy to feel totally unstoppable and indestructible. However, when it comes to joint health, studies have shown that individuals who regularly engage in high-impact sports such as football, sprinting, rugby, and gymnastics are at a greater risk of developing osteoarthritis compared to the general population. This is because high-impact sports put excess stress and pressure on weight-bearing joints such as the knees, hips, and ankles, which wears down on cartilage and greatly increases the chance of experiencing high-impact injuries. So, while there's nothing wrong with playing these types of sports for fun, it's important to remember humans aren't made of steel. We're made from bone, muscle, and soft tissue. And despite what your favorite fitness guru might say, more pain does not equal more gain. Rather, more pain equals more chance of injury, more chance of permanent joint damage, and more chance of developing osteoarthritis. So, if you decide to forgo the risks, or perhaps you're an athlete and this is your career, make sure you take care of your joints. Always do warm-up and cool-down stretches before and after playing, and if applicable, always wear protective pads on your knees and elbows and a helmet to protect your head. It's also a good idea to connect with an orthopedic doctor to regularly monitor your joint health and prevent any underlying issues from becoming more severe. But as a general rule, try to remember this. If you have to put your health on the line in order to cross the finish line, it's not worth the risk. Tip 2. Avoid certain physical activities and movements. When you're at the gym, it can be tempting to add a few extra kilos to your weight so you can impress your friends or your crush with your weightlifting skills. However, by taking on more than you can handle, you'll not only be putting unwanted excess pressure on your muscles and joints, which in the short term can lead to injury, but you'll also be increasing your risk of developing osteoarthritis. This is because osteoarthritis is known as the wear and tear disease. This means that repetitive strain and excess pressure caused by movements such as kneeling, squatting, and heavy lifting can cause the cartilage in your joints to wear down prematurely, resulting in early onset of osteoarthritis. However, while it's best to limit these types of movements as much as possible, if you must, then it's important that you take the necessary precautions in order to reduce your risk of injury. For instance, always practice safe manual handling techniques, take regular breaks, and ask for assistance when you need it. And most importantly, if you don't think you're able to lift, move, or push something by yourself, don't do it. It's not worth the risk. Tip 3. Exercise regularly. As you know, certain high-impact weight-bearing exercises can damage your joints and speed up the progression of osteoarthritis. But hold up, there's no need to cancel your gym membership or throw away your running shoes. In fact, research suggests that regular, low-impact exercise can actually prevent and slow the progression of osteoarthritis by improving cardiovascular health, assisting with weight loss, and increasing joint, bone, and muscle strength. Aim for exercises that combine cardio, strength training, and stretching, such as biking, walking, or using an elliptical trainer. Swimming is also a great choice. The buoyancy of the water can greatly reduce the load on your joints, while also providing enough resistance to help strengthen your muscles. Try to work your way up to 30 minutes of low-impact exercise at least 4 to 5 times per week. If you're unsure of what exercise is best for you, talk to your doctor or physiotherapist. They can suggest an exercise program that is safe and effective based on your individual needs and current level of fitness. Tip 4. Take care of painful and swollen joints. We've all been there. After going a little too hard at the gym, you wake up the next morning with a fitness hangover. Your body aches, your muscles are sore, and your joints are swollen and really painful. When this happens, let your joints rest for at least 12 to 24 hours. Apply ice to reduce inflammation, and then follow up with a heat pack to increase blood flow and reduce pain. If you experience any pain or swelling that lasts longer than usual, speak to your doctor or a physiotherapist. If you do sustain an injury, even a minor one, it's important to let it heal correctly in order to reduce the risk of developing osteoarthritis in that particular part of your body in the future. Tip 5. Run smarter. While running doesn't directly cause osteoarthritis, it can increase your risk of experiencing chronic injuries and permanent joint damage. So if you love running or you're thinking of starting up, here's a few tips to keep in mind. If you're just starting out, take it slow. Start with short distances and gradually increase your pace as you feel more comfortable. If you feel pain, swelling, or discomfort, take a break and monitor your symptoms over the next 12 to 24 hours. Avoid running on hard, uneven surfaces such as asphalt or concrete, and instead stick to grass, synthetic tracks, or treadmills. Wear comfortable running shoes with adequate cushioning and shock absorption to reduce the amount of impact and pressure on your knees and ankles. Lastly, give yourself time to recover. All runners need to have recovery days to allow their bodies to repair and recover. Remember, pain doesn't equal gain. Pushing your body past its limits will only cause injury, so take a break and give your joints a chance to rest. Tip 6. Maintain a healthy weight. Did you know that being overweight greatly increases your risk of developing osteoarthritis? That's because excess weight equals excess pressure on your joints. So the more you weigh, the more stressed and damaged your joints become. In fact, being just 5 kilograms overweight puts an extra 10 to 15 kilograms of pressure on your knees. But that's not the only problem. Fat tissue produces certain proteins that cause inflammation in your body and in long term damages your joints. Luckily, by losing those extra kilos, you can help to postpone or even prevent the onset of osteoarthritis. To lose weight, you need to burn off more energy than you consume. Start by ditching the junk food and adding more lean protein and fresh fruits and vegetables to your diet. It's also important to increase your level of activity. Find yourself a new low-impact exercise to try, or use the activity tracker on your watch or smartphone and set yourself a goal to take 10,000 steps per day. This might seem like a lot, but by regularly keeping your body moving throughout the day, you'll be surprised at how quickly your steps add up. If you need extra assistance or advice for achieving your weight loss goals, schedule an appointment with your doctor or healthcare professional. Tip 7. Eat a healthy diet. Eating a balanced, nutritious diet is not only essential for maintaining a healthy weight, but it's also essential for providing your body with the tools it needs in order to prevent and slow the progression of osteoarthritis. Aim to fill your plate with plenty of fresh fruits and vegetables. Fruits and vegetables are high in fiber, antioxidants, and vitamins A, E, and C, which can help to neutralize inflammation and prevent joint damage. You should also aim to eat plenty of foods that are rich in vitamin D and omega-3 fatty acids. These include fatty fish such as salmon, tuna, and herring, as well as eggs, nuts, fortified cereals, and low-fat dairy products. Omega-3 helps to reduce inflammation, whilst vitamin D maintains muscle, joint, and bone strength. Okay, so now that we have the good stuff sorted, it's time to tackle the bad stuff. Research suggests that the 3 worst types of foods to eat when you're trying to prevent osteoarthritis is processed sugar, saturated fats, and refined carbohydrates. When consumed, these foods release proteins and chemicals in the body, which cause inflammation to spread to your joints and muscles. They also increase your risk of developing obesity, diabetes, hypertension, and heart disease. So, as a rule, cut these foods out of your diet and only eat them as a special treat every now and then. Tip 8. Control your blood sugar levels. If you have diabetes or a condition that affects your blood sugar levels, you could be at a greater risk of developing osteoarthritis. This is because high glucose levels can accelerate the formation of molecules that contribute to cartilage loss. To help lower your blood sugar levels, make sure you exercise regularly, drink plenty of water, manage your sugar and carbohydrate intake, and try to decrease your stress levels. If you'd like to learn some helpful tips for managing diabetes, be sure to watch our dedicated video linked in the description of this video. And while you're at it, be sure to check out other helpful videos on our channel too. See how to effectively lower your blood pressure and tips for practical and sustainable weight loss. Thanks for watching. Be sure to like this video, subscribe, leave us a comment, and turn on that notification bell so we can stay in touch.